I work at the Mayor's Office for Immigrant Advancement for the City of Boston. We're essentially the city's agency to inform other agencies throughout our local government as to how to best serve our immigrant residents. And in Boston, that's 28% of the population. Depending on where you are throughout the United States, many major cities are creating offices like this themselves, or have already had them for 15 to 20 years. So the first thing I wanted to talk about was the 2020 census, which is not actually an immigration policy, but it is something that the federal government will be implementing this year. And last year there was significant concern all around from not only immigrants' rights groups, but also jurisdictions that have many immigrant residents, that the citizenship question would be asked in this census. The citizenship question will not be on the census after all, but there is still concern that there will be low participation. So there are efforts throughout the country by civil society organizations, nonprofit organizations, faith-based organizations, community organizations, along with city, county, and state governments to try to drive up participation. Of course, the U.S. Census Bureau does give some resources towards participation, but there's concern that it's less than it has been in the past, and that it's more needed now because of fears from foreign-born residents as to how their information will be used. But of course, the census data is incredibly important because it determines where and how federal dollars will be spent, and it determines political representation, and is then also used for all sorts of research and planning purposes. Next, I want to go over DACA, or Deferred Action for Childhood Arrivals. So just as a reminder, DACA is not, even though it gets associated with children, it is not, DACA recipients are not largely children. They are largely young adults. Roughly speaking, right now it's a cohort of 17 to 38-year-olds who otherwise would not have immigration status in the United States. And right now there are somewhere in the realm of 650,000 people with this status. As of September 3rd, 2017, no new applications are being accepted, but those who currently have it or have had it in the past can keep on submitting renewal applications for now. And it is expected that the U.S. Supreme Court will make a final decision regarding the legality of DACA by June 2020. It's expected at the end of June 2020 specifically. And right now, those who work with DACA recipients and DACA recipients themselves, who are leaders in the Dreamer sort of movement, are concerned about anxiety for those with DACA who are worried that their DACA might cease to exist. And so they are encouraging everyone to promote mental health resources, and I've included a couple of web links there that are toolkits specifically for this topic. Next, I want to talk about public charge. So this term public charge, you may have heard get thrown around in the immigration context recently, and it's been around for about as long as the United States has had immigration restrictionist policies. And it's defined as someone who's likely to become primarily dependent on the government for subsistence, which is pretty vague. And in recent years, it has been very, very limited, just limited to receiving cash assistance from the government, from the federal government, or needing long-term institutional care. The Trump administration has expanded this rule, and the important thing to note is that there are 3 federal agencies that apply this definition in two different ways, in two different rules. And so the big one that's about to go into effect is the Department of Homeland Security rule, which is going into effect on February 24th of this year. So this applies to most people who are already present in the U.S. who are applying for a green card or a visa. So only people who are currently in the U.S. who are applying for a green card or a visa. So that's a limited number of immigrants, but more broadly, all of this chatter about this topic has folks like myself concerned about a chilling effect, and a lot of public health officials are also concerned about this. So we're concerned that immigrants who are unaffected by this rule will disenroll from programs. We're also concerned that immigrants who may or may not be affected by this rule will disenroll from programs that are not covered by the rule, even the rule is expanded. And I dedicated a slide just to this website. This is the Protecting Immigrant Families National Campaign website. They have simple and easy to digest information that is public-facing, and they have more complicated analyses for folks like yourselves as well. So if nothing else, go to this website and use it. So the rest of the materials here are just for your reference. These are found on that website. And just don't forget that most immigrants will not be affected by this. Citizens are not affected by this. Green card holders applying for citizenship are not affected by this unless they've been outside of the country for more than 6 months. And many public programs are not considered in this determination. I'm going to skip over the other federal policy changes, but just so you know, there's the travel bans, TPS or protected status, and increased border restrictions of all sorts. And finally, I'd like to thank and recognize a couple of my interns.